really interesting article here by Ollie Vargas about the different response to the coronavirus pandemic in Bolivia, which was overthrown. The democratically elected government of Evo Morales was overthrown in a right-wing military coup last November, versus Cuba and its socialized model of medicine, which has just had a amazing response to this virus. A dispatch from Bolivia shows the staggering human toll of the military coup as an incompetent U.S.-backed regime leaves impoverished citizens to die amid a pandemic. In Cuba, meanwhile, the country's socialized system has saved its population from the worst of COVID-19. Let's be frank, I would much rather be living in Cuba right now than the United States for, frankly, for a number of reasons, honestly. Cochabamba, Bolivia. As Latin America becomes the new focal point of the devastating spread of COVID-19, Cuba stands virtually alone in having saved its population from the dramatic health and societal collapse seen across most of the region. At the other extreme is Bolivia, where the coup regime is using the trauma of mass graves and corpses in the streets, the fruits of its own inaction, as an excuse to ban elections, which they've postponed for a third time. Close look at the divergent results of the two countries gives an insight into how two opposing ideological models have shaped the situation that Cuba and Bolivia find themselves in today. It definitely seems like the United States response is definitely more in line with Bolivia than the Cuban model, given that the United States has more cases than any country in the world, along with more deaths, etc. The two countries have roughly the same population of about 11 million and were among the last in the region to see their first imported cases. COVID arrived in Bolivia on March 10th. It hit Cuba the following day. Similarities end there. At the time of this writing, Cuba has yet to see a single medical professional or child die from the virus. I just saw last week there's a 9-year-old in Florida who died of that. Florida, only 90 miles away is the island of Cuba, and has a total of 2,495 cases. The U.S. has almost 5 million. Meanwhile, Bolivia had 1,825 cases of COVID-19 just in the last 24 hours, adding to a staggering national total of 68,281 infections. I mean, roughly the same population. Cuba has less than 2,500, while Bolivia has almost 70,000. I mean, wow. I mean, those numbers speak for themselves, obviously. Cuba has suffered 87 deaths from the virus, while Bolivia has suffered a whopping 2,535. The number of tests carried out is a core component of any COVID-19 strategy. If those are presenting symptoms or are carriers of the virus are not able to access tests, then it can make tracing and isolating impossible. So far, Cuba, a blockaded country, has carried out 247,000 and 203 tests in Bolivia. In Bolivia, where the coup regime has complained that such tests are expensive to acquire, only 134,769 have been carried out. This is an extraordinarily low number in comparison not just to Cuba, but to immediate neighbors like Peru, who's carried out 2 million tests. Instead of buying tests, Bolivia's incompetent government purchased 500 faulty ventilators at inflated prices. Of course they did. The corruption scandal forced the country's health minister, Marcelo Navajas, to resign after just a few miserable weeks on the job. Socialized public health, case in Cuba, versus profiteering and price gouging in reference to Bolivia. The strengths of Cuba's socialized health system are well known. Figures from the World Health Organization show that the island has the highest doctor-to-patient ratio in the world, with 8.4 per 100,000 in the population compared to just 2.6 in the U.S. And again, U.S. is one of the, I think, only industrialized or so-called developed countries in the world without universal health care, while we pay more than any other country, often double and we have these horrible health outcomes like this. The infant mortality rate, because obviously there should not be any profit motive in healthcare. That is disgusting. The infant mortality rate in Cuba is 4 per 1,000 live births, the same as the UK and Denmark, while the US stands at 6 per 100,000. The statistics alone are a testament to Cuba's general preparedness for the challenge of COVID-19, but beyond its superior public health system, Cuba's concrete pandemic prevention strategy has been far more advanced than most around the world. And, it should also be noted that Cuba has actually been sending doctors through this whole pandemic to different countries in the world to help those countries out. Ariana Campero was the former Minister of Health in Evo Morales' government between 2015 and 18 and served as Bolivian ambassador to Cuba, where she lives today. She detailed for me the prevention system that sets Cuba apart from Bolivia and other neoliberal governments in the region. Quote, unlike Bolivia, Cuba has had a real plan, most importantly in its active search for cases through primarily healthcare provision. An example of this, how the nurse assigned to a neighborhood comes by our house every single day to check that no one is presenting symptoms or has had contact with anyone who's been abroad recently. Wow. Did you imagine that happening in the U.S.? Right? Or any change of circumstances that would expose the family to COVID-19. Imagine just the connection that those nurses and healthcare workers have to the communities that they work in, literally going door to door, day after day, checking on people. I mean, that is amazing. And they have the most doctors per capita in the world. While Cuba's early measures allowed its governments to run a properly functioning track and trace operation, the Bolivian coup regime sat on its hands as COVID-19 inched towards its borders. Don Fitz, a leading academic expert in Cuba's health systems, explained to the Gray Zone, quote, the only reason the Cuba's tracking system has worked is the coronavirus plan for prevention and control was implemented on March 2nd, 2020. Within 4 days, it expanded the plan to include taking the temperatures of and possibly isolating infected and coming travelers. These occurred before Cuba's first confirmed COVID-19 diagnosis on March 11th, so just really prepared on top of it. Cuba had its first confirmed COVID-19 fatality by March 22nd, when there were 35 confirmed cases, almost 1,000 patients being observed in hospitals, and over 30,000 people under surveillance at home. The next day, it banned the entry of non-resident foreigners. Conversely, Bolivia has almost no discernible strategy, very similar to the United States in that regard. Following the coup against Evo Morales in November 2019, Bolivia focused instead on purging its public sphere of anything that could be remotely connected to Cuba. The new government formally broke off diplomatic relations and expelled 700 Cuban medical professionals stationed there. While Bolivia health ministers once sought to emulate Cuba, the coup government of Jeanine Áñez, really just trash person obviously, turned to the private sector and appointed Marcelo Navajas, an owner of elite private clinic in the upper class south side of La Paz, as health minister just as COVID-19 cases began to surge. The ideological divergence handicapped the country as it careened into the current health crisis. Before the coup, Cuban doctors were running entire hospitals in working class and urban rural areas of Bolivia. Today, those clinics are still empty. The government claims to have plans to open one of the clinics in La Paz, but said nothing of the others. I visited a former Cuban clinic in the working class Vallejo Hermosa district in the city Cochabamba. The establishment was home to 143 Cuban doctors providing free health care to the community. Those are the people that the coup government expelled. Because of they're wanting to neoliberalize and privatize everything in Bolivia for profit and open up to these multinational corporations to exploit the people and the natural resources there. When I visited the area in January 2020, the gates were locked and only the information was a handwritten sign reading, "There's no service, there are no doctors, there are no nurses." Again, the coup took place that overthrew the democratic elected government of Evo Morales in November 2018. Today, more than 4 months since the start of the pandemic, the clinic's gates are still closed. Maria Rodriguez, Valle Hermosa resident, explained to local media in June how her husband had been receiving long-standing treatment for pulmonary fibrosis at the Cuban hospital, is now unable to access any service at all since the pandemic hit. Quote, We're told that it'd only be closed for a short time, Rodriguez said, that they just needed to hire new staff. We had to go to the Hospital del Sur to continue with treatment. It was okay there, but a week ago when I went, they didn't even let us in because they said everything's full. They don't want to treat him anywhere. The closure of the Cuban clinics is a particularly bitter twist now that Bolivia's private-driven health system is falling apart at the seams. The largest hospital in Cochabamba declared itself collapsed over a month ago. In neighboring Quillacola, one doctor spoke anonymously to Cowascha News, where I'm employed, revealing that though staff hadn't been paid since March, they're still expected to perform 24-hour shifts. At times, they've had to leave dead bodies on the floor of the hospital without any material with which to wrap them. So what happens when you switch from a socialized medicine model to a private for-profit model? It's disgusting. And, I lived in the United States. Horrible, horrible healthcare system that's run for profit. Again, much rather be living in Cuba right now than the United States, for sure. Thanks to the government inaction, clinics are charging COVID-19 patients up to $3,000 per night for a hospital stay, then charging again at inflated prices for each medication used during the stay. Where the state has failed, local authorities have done what they can, but they're hamstrung by austerity measures that starved the municipalities of government funding. This policy began after the coup and before the pandemic. Alvaro Ruiz, mayor of Uriondo and president of the Federation of Municipal Associations, told the Gray Zone, there are a lot of projects in water, health, education that are now paralyzed because the central government has cut local authority budgets. We can't allow our people to go backwards and lose the social gains made thanks to work and coordination under Evo Morales. I mean, for God's sakes, it's like, just the differences here are so striking, but again, not surprising when you have this right-wing military coup overthrow the democratically elected government of Evo Morales, who was a champion of the working people, of the working class in Bolivia, who really took their interests to heart and governed with them in mind. When you have them overthrown by, this right-wing military coup that wants to privatize and introduce austerity to benefit the elites of that country and, other Western imperial interests, this is the obvious result of that, as opposed to Cuba and their socialized medicine model, where nurses are going door to door, day after day in the neighborhoods that they work in to check on the people there. I mean, for God's sakes, it's stunning. It's stunning. And there's even Cuba with the economic blockade is still doing amazing with the response to this coronavirus pandemic. The island has spent decades developing a first-rate biotech industry. The state initiative was launched during Fidel Castro's period of presidency, when the Center for Genetic Engineering and Biotechnology was founded to carry out world-leading research. I mean, look at that. It's awesome. The vast majority of the medication used in the country, as well as 300 products for export. The Cuban-made interferon alpha B2 has proved to be a lifesaver. They began producing it in 1981 to combat dengue fever. Since then, the drug has come into international demand. Looks like it's now being exported by Cuba to 72 countries to help fight the symptoms of COVID-19. Cuba currently has a mortality rate of just 3.7% compared to 5.71% through Latin America. And again, this is with the U.S. blockade. I mean, while in Bolivia, where the U.S. has offered full-throated support for the coup regime, doctors' associations have become increasingly desperate about the regime's failure to provide adequate medications. In the Amazonian department of Beni, one of the worst affected regions, the medical college has formally asked the state to import interferon alpha B2 from Cuba, but the request has fallen on deaf ears. The medicine shortages have forced desperate Bolivians to turn to herbs and forgotten ancestral medicine. The primary ingredient used in these remedies include eucalyptus, ginger, honey, and a plant called hira hira. These elements contain medicinal properties that have been used for generations in rural indigenous communities. Hira hira can help with respiratory problems, for instance, and ginger boosts the immune system. Okay, I'm not going to read all of this, but and then the strain on the health system is not the only crisis caused by the pandemic. Let's see. In Cuba, those under lockdown have been receiving 60% of their salary to help with the cost of living. While in Bolivia, the government has presided over the mass impoverishment of its own population through a strict implementation of lockdown coupled with almost total absence of any support for the millions who lost income. Very familiar to what's happening in the United States. 38% of Bolivians have lost their entirety of their earnings. I mean, it's, again, just the differences between Cuba and Bolivia right now with how they've handled the coronavirus pandemic, both from a public health and economic perspective, are night and day. Again, I would much rather be living in Cuba right now than the United States. This is from Ali Vargas. As a Bolivian journalist and writer, he's contributed to Telesur, Morning Star, and other media outlets, and I'll link this article in the description box down below. Peace. All power to the people. Much love.